Welcome to the Employment, Law, and HR Podcast with your host, Alison Colley.
Hello and welcome to this episode 201 of the Employment Law and HR podcast. I'm your host, Alison Colley. I'm an employment solicitor and HR specialist, and I run the firm Real Employment Law Advice, where together with my colleagues, we provide advice and assistance to both employers and employees on all aspects of employment law. Our flagship service for our employer clients is our HR Harbour membership. If you become a member of the HR Harbour, you have ongoing support and assistance throughout the year for a fixed monthly fee. There are 3 levels of service: silver, gold and platinum. And depending on the size of your business and your needs, we can be your HR outsourced business partner, providing all of the advice and assistance on both employment law and HR that you need. If you'd like more information about the service and the type of work that we do for our clients, then please don't hesitate to get in touch for a free, no obligation quote. You can contact me. It's Alison at realemploymentadvice.co.uk. Now, without further ado, I'm going to get into this week's featured content. I'm really pleased to be joined on the podcast today by Kate Davies. Kate is an independent fertility and women's health nurse consultant, and she's the director of Your Fertility Journey Limited. It's an independent clinic supporting the fertility and women's health needs of individuals across the UK. Okay, I'm here with Kate. Welcome to the podcast, Kate. It's lovely to have you on.
Thank you, Alison. It's lovely to be here. Thank you for inviting me.
And so I've said a little bit about your background in the intro, but do you want to just explain to everyone what you do and a little bit about yourself?
So I'm an independent fertility nurse consultant, and about 10 years ago, I set up in private practice. And the reason that I did that was I was quite frustrated at the lack of support given to women and couples who are trying to conceive on the NHS, and felt that there was a big gap and that there was a lot of information that could be given to couples to help them to conceive that really wasn't given in a timely manner, and hopefully reduce their time to conception, and mean that for some couples, IVF, for example, which I feel in the UK there's a very quick push towards, for some couples that wouldn't necessarily be needed if they got the right information at the right time. So that's what I set up 10 years ago. And then the business has developed over those 10 years. I work with a lot of organisations within the fertility industry as an expert, helping them on a consultancy basis. But about 2.5 years ago, I started working with organisations outside the fertility industry on their wellbeing programmes. I think one of the benefits, I guess, or one of the things that COVID has given us is an increase in wellbeing programs within organisations, specifically around aspects that impact on mental health. And clearly a fertility journey, IVF treatments really do impact on mental health. So I started working with these organisations, and we've been so lucky. We've worked with some incredible organisations to work on their wellbeing programs, providing employee webinars, educational webinars surrounding topics on fertility, women's health, pregnancy loss, menopause, and also line manager training, and then working with organisations to help them create policies so that they can show that they are supporting their employees and their fertility issues at work, because it's such an important topic, and a topic that we don't often talk about, because why would we want to talk about fertility in the workplace? But it's such an important topic, and my philosophy is that we should all feel that we can bring our whole selves to the workplace, and that includes whatever is going on in your life at that time.
Yeah, absolutely. And that's how I came across your details in relation to the work you were doing with Innocent Smoothies, wasn't it? So I saw your post from them on Facebook. I always follow them on Facebook because I think some of their posts hilarious. And they mentioned that they had just introduced a fertility policy. And of course, being my area of interest, I had a look further and that you were tagged in that as helping them. How did it come about that you were working with them?
Actually, that one came from a patient of mine who worked for Innocent and was really happy to recommend me once she was going through IVF, and once she had finished her IVF journey, she said, you know what, I want to recommend you because this is an area that we're not covering within our organisation, and I feel that we really, really need to. So that was a really lovely one to be recommended in that way. And Innocent, I have to say, have been absolutely fantastic. They've been an utter joy to work with. They've been completely overwhelmed by the positive experience that not only their employees have found the kind of development of their policy and the fertility education webinars that we did, but also the wider audience. I mean, I was completely blown away on the Facebook posts and the Instagram posts where the messages of support for what they've done has been incredible. And I think they were completely flabbergasted, and I was, and it was just such lovely reading all of these really positive comments. And so, so they were a total joy to work with, and hopefully we've got a bit of longevity going forward as well, and be able to support them with some other topics around women's health too.
Yeah, because this is all very new, isn't it? Let's be honest, in terms of the world of work, introducing, recently menopause policies and now fertility. So it is sort of quite trailblazing, I guess. And I suppose that's why, it's got quite a lot of attention from their audience about what they're doing. So what was their, and obviously the other organisations you work with, what's their motivation by introducing a policy into their procedures?
That's a really interesting question, because often with something like this, particularly around mental health issues, sometimes it can often be driven by employees asking for it. But sadly, when it comes to fertility, individuals don't really talk about their fertility journey in the workplace. It's just not something that they feel comfortable about talking about. I'm very lucky that I'm not the only one within the industry that is doing this great work. I work very closely with an organisation called Fertility Matters at Work, and I support them on the clinical side. And they've done quite a lot of research. And they have shown that over 60% of employees don't feel confident to divulge their fertility journey to their employer, which is really sad. So it doesn't seem that it's necessarily driven, unless it's a very, very brave employee. It's not necessarily driven by the employee to say to their employers, we need to do something about this. So it in part has come about, I think, because organisations are starting to think more widely. They're aware that they need to talk about menopause in the workplace. They have probably done some discussion around that. They probably have menopause policies. And I think fertility and women's health issues are the natural progression, the next step. But I think this has also been driven by, there is currently a proposed private members' bill going through Parliament. I think it's been read twice now, looking at improving the experiences for women and couples undergoing IVF within the workplace, and hoping that eventually there will be some allotted and allowed time off to attend appointments. And this is really important because the World Health Organization describe infertility as a disease. And so we should be viewing infertility in the same light that we would any other disorder or disease, like diabetes, any chronic cancer diagnosis, whatever it might be, and allowing employees to have that time off. Currently, we don't. There's no right for any fertility leave. Unlike maternity leave, clearly there's a right to have maternity leave. There's no right currently. And the MP Nikki Aiken is doing some really great work in this space, and supported by a lot of organisations like Fertility Matters at Work, who are also doing so. So I think that's where the awareness is beginning to increase. But we've still got a long, long way to go. There are still a lot of organisations that are interested. And to give you an example, luckily, I did end up working with this organisation, but about a year ago, and it was an organisation in defence. And their first question to me when I had a call with them was, how relevant is this, given the fact that we have majority male employees? Majority population is male. I was like, well, A, it takes two to tango, and B, male infertility is on the rise. It's the same as female infertility. And there's 1 in 6 couples struggle with infertility and 1 in 7 individuals. So it is totally and utterly relevant for a male-dominated employee as well. So they, like I said, luckily they did start working with me and we did some great stuff. But that just shows you there is still that resistance among organisations to be thinking more about fertility policies and education in the workplace.
Yes, so you make a very good point there about it being both an issue that men and women in the workplace would deal with on a regular basis. And it's interesting that there is some push to go through with some legal protections or legal rights in relation to fertility, because I have been asked a few times over the years by both employees and employers, what's the legal requirements, if you like, for an employee going through fertility treatment? It becomes quite complex in relation to when actually somebody is considered to be pregnant. And when you try to explain it, it's all very technical in relation to the implantation, isn't it?
That's right. Yeah, because once you've had implantation, you are pregnant until proven otherwise.
Yes.
So it's a very grey area, isn't it?
Yes. And so, my advice is always to employers, particularly that obviously it's at your discretion, but this is clearly an important life event and something that's going to be causing significant stress potentially to that employee. So to think about it in that way. But I also think that there are some, particularly women, who are worried about talking about fertility, because then obviously in the employer's mind, that leads to maternity leave and time off.
Absolutely. And I think that is why most people feel really uncomfortable about discussing it. And actually the research that Fertility Masters at Work found that 69% took sick leave, but didn't say what that sick leave was for, but they just took sick leave to attend appointments. And I think it's really unfair that we feel that we have to take sick leave to attend a hospital appointment when you're not actually sick, but because they didn't feel comfortable about discussing it within the workplace, whether it be for just because it's an uncomfortable subject or whether it be because they're concerned about career prospects. And, I hear from my patients all the time that is a big concern for them. But I think for employers and organisations to kind of tip that up on its head and think that, again, research shows us that over 30% of individuals will leave their job or reduce their hours based on their fertility struggle and going through IVF. Now, sadly, that's often when women are incredibly experienced in their career. They've got so much to give the organisation, and therefore that retention issue is going to be huge, and that presents a massive organisational challenge, doesn't it? And I think it's really sad to lose those women at such an important stage in their career when they have got so much to offer. But inevitably, creating their family is going to take priority at that point if their employer isn't supportive to them.
Yeah, and we are at a time where many businesses are facing skills shortages and there is a lack of people out there to do the work that's required. So you do need to think more creatively, I think, as an employer to retain staff. Otherwise, you're going to end up with a huge gap in the talent market. And, it's interesting you say there, and I think I mentioned this when we spoke before, but in my profession as a solicitor, I seem to know a disproportionately high number of women solicitors who have had fertility issues and have gone through treatment. And I actually know several of them who have ended up either leaving their employment or taking significant amount of time off whilst they were going through that because of the pressures and stress and inflexibility that's created within the profession. I am going back 15 years, I suppose, so I would like to think that things have changed somewhat, but
I don't think they have. I think we're beginning to see change, and with more and more awareness, that will definitely change, but we're such a long way away. But I think that, having talked to my patients about, and I think this is why I got interested in fertility in the workplace, women's health issues in the workplace, was my patients were telling me that there's struggle, this difficulty, this not being able to talk to their employer, not feeling that they can, worried about career progression. But when they do, and if they've got a supportive line manager, the difference that makes to them, both in their mental health and their ability to juggle their IVF and their career and their day-to-day work, is huge. So they're more productive, they're going to stay in their job, they're not going to leave because they've got this supportive employer. And that's not just for women. I've just been talking and recording for my podcast with a lovely chap called Sean, who went through male factor infertility himself, and he's now retraining as a male coach. And he said that in his career, in his organisation that he worked for, he didn't talk to them for a very, very long time, a very male-dominated organisation, didn't talk to them, felt they couldn't. But eventually, when the point came to the fact that he really needed to, because of male factor infertility, he was going through a lot of investigations himself. When eventually he did, that made a significant difference to how he felt about his employers, how he felt about his career, how they felt about his work, and it just took the pressure off. And he's then stayed in his employment and just had such a good experience. Sadly, not all experiences are that good, but it just shows you that it's not just women. We do need to think about men and the impact on their career too.
And actually, as women, we become quite used to talking about sensitive matters. Whilst we might not like to, we actually tend to find it easier to talk, don't we? Generally, we tend to open up to other girlfriends about health and well-being, but men traditionally don't like to talk. So I can imagine that in that situation, for a man, it must be quite hard to approach their employer, especially if it's a male-orientated environment, which is where I guess having a policy and setting out how you feel as an employer is really important.
Yeah, I think it is really important. I'm always very wary of an organisation that just wants to have a policy, because a policy is not worth the paper that it's written on or the space on the intranet that it's written on, unless you clearly change the culture of that organisation. And changing the culture is by getting the subject talked about. And that's where the webinars that I do start those conversations. And some of the organisations that I've worked with have gone on then to develop peer support groups, menopause cafes, fertility cafes, where employees get together and share their experiences and get support. And that's really important. And peer support group networks are vital, because if an individual has a line manager that they feel that they can't talk to, or the line manager shuts down that conversation, perhaps because they're embarrassed, or maybe it's triggering for them, which, is perfectly reasonable, then actually knowing that they can go and get that support elsewhere from a peer support or HR or whomever. But knowing, I think a lot of people think that it stops with their line manager, and if they're not getting what they need from their line manager, then they're completely lost. But having those other avenues are really important.
And that's another good point, isn't it? That actually, if the culture hasn't changed, and the way in which people behave internally, you can have all of the mission statements, policies in the world. It's going to make no difference at all. And the same thing goes with the introduction of law, really, let's be honest, because yes, there is often a legal requirement, but I don't ever expect the government to go beyond the bare minimum.
No. Even if they do, I don't even know whether it'll be successful. I'm not holding out a huge amount of hope that it will. It would be lovely if it was. But yeah, I think you're right. It will be the bare minimum. And if you think about an IVF cycle, a woman probably needs to attend her clinic for about 9 occasions. That's not 9 full days, but 9 occasions during one cycle of fertility treatment. Well, that's not going to be possible to support that. So there's going to be some leeway for sure, but just having that understanding, I think, and like you say, changing that culture is the first steps, which is vital.
Yeah. Judging by their response to the menopause consultation, I don't hold out high hopes. I think, my response to that was always that change comes from the people, really. It might sound fairly cheesy, but it does. It comes from what employees expect in the workplace these days, what is acceptable, what you look for in employers, but also if you're for suppliers and where you're shopping and all of that sort of thing. Innocent are quite a good example of this, because they have lots of great morals and values that they profess and actually follow through on. And so there would always be a product of choice, if I were thinking, because of that. So I think it does come from pressure from employees, but also from the market as well, as to be a good employer and to share that.
I agree. And I think if you found an employer that showed that they were supporting the fertility or women's health, menopause needs, that for me would be attractive, because that's important. It's part of our lifespan as a woman, all these different touch points. And if they're supported by your employer, then that would make me want to work with that employer more over somebody else.
And so if an employer is listening to this, or someone in HR thinking, actually, this would be great for my business or organisation, how would you recommend they start out on that kind of journey for introducing or changing the culture, I guess, in relation to fertility?
I think by, first of all, talking to their employees and finding out what would interest them. So starting that conversation from grassroots, thinking, right, okay, what needs do we need to consider within our organisation. Don't assume, like, for example, I get a lot of people saying to me, no, I don't think anyone in our organisation's had a miscarriage because, we're not told about it. 1 in 3 women struggle and suffer with miscarriage. So therefore, your organisation or, 1 in 3 members in your in your office will have experienced a miscarriage, but you won't know about it. So it doesn't mean to say it's not a topic of interest. So I think it's kind of having those discussions, what interests them, and then finding out what they need. That's most important, is what do the organisation need? When I work with organisations, I know what I can offer, but I always start off by saying, what are you hearing from your employees? What do your employees want? What does your organisation want? You know your organisation better than me. What do you need from me? And then I work with employers to start on that. So I think starting having those conversations with their employees, and then thinking about the launch of a fertility policy. But as I mentioned, not just launching that fertility policy, but perhaps combining that launch with some line manager training, some employee educational webinars to get people talking and feel comfortable about having those conversations in the workplace. And that then starts this cascade of wonderfulness, which I found. And like I said, the development of peer support groups, etc. So that's where it needs to start.
And we've already touched on lots of the benefits for this, but often employers will say, well, what's the bottom line? What's the benefit to me of going through this piece of work and introducing this kind of policy or change within the organisation?
I think, as we mentioned, the biggest one is retention. So keeping your talent, which is vital in employment and within your organisation. I think that the benefits, as we saw with Innocent, the fact that Innocent are talking about this subject has been so well embraced by their community and in such a positive, lovely way that, again, they're seen in such a great light. Again, can Innocent be seen in any more of a fantastic light than they already are? It seems like they can. So again, it's showcasing that the employer or the organisation cares about their employees, and that benefit is just massive.
Yeah. So it's reputationally, both internally and externally, isn't it?
100%.
Because from a legal perspective, I suppose there's very low risk in terms of your obligations, as we've touched upon. The one thing I guess I would highlight is in relation to an employee who may have had a miscarriage or may be going through fertility treatment. It's obviously the health and safety requirements there. Is there anything that you would potentially advise employers in relation to the kind of steps that they should be taking to make adjustments for somebody going through fertility treatment?
Yeah, there are a number of things that you can do. So, for example, when you're going through fertility treatment, you might need to, you will need to medicate. And often this can be injections at various times throughout the day. So having a fridge where you can store injections so they're not kept with a normal fridge in a kitchen with other people's food, for example. Then so having a dedicated fridge is great. Having a place where you can go and administer your medication. Because would you really want to be going into a toilet to do that? I know I certainly wouldn't, from an infection control point of view, wouldn't want to go in and administer an injection to my stomach in a toilet because it doesn't seem clean and hygienic. So somewhere with hand washing facilities that's quiet, that you're not going to be disturbed. So having those areas, I think, are really important. Having that time out area, just somewhere that you can go, and I think Innocent have done that. They've got a time out area where you can just go and be if you feel that everything is becoming too much and overwhelming. So there's lots of different reasonable adjustments I think that you can make in the workplace that shouldn't be too difficult, but will actually mean so much to an employee.
And actually the 3 main things you said there would help in a number of situations. When somebody returns from maternity leave, for example, having somewhere that they can store milk, or where they can go to express, all of that sort of thing, or to breastfeed, would be the same sort of space you would create in relation to injecting and storing medicines. Having a quiet space is the same sort of thing you'd have for somebody who have a neurodevelopmental condition. So actually there are, one adjustment can fit multiple different employee needs, can't it? So
yes, it can. I think there probably need to be a bit of sensitivities around a room for breastfeeding and a room for a woman going through IVF. That wouldn't be the right environment to go into and administer your medications. If you were going to come across a lady breastfeeding or expressing, that might be a little bit difficult. But you're absolutely right that those rooms could be multi-use. For anybody on long-term medication, that could be a benefit.
Yes. And actually, that's another point I want to pick up on there. I have interviewed a couple of ladies who are from an organisation who help to support childless women. And we were talking particularly about childless women in the workplace. And one of the points that they highlighted and one of the adjustments that they suggested employers could make is in relation to when somebody does, have a new baby and bring the new baby into the office. And you said about the sensitivities there of potentially somebody going through fertility treatment.
I completely agree with you. That's something that I come across a lot. And I think it's so lovely. And I think we should absolutely celebrate the good as well as the difficult times. And celebrating the good is celebrating a new baby that is born. And that should absolutely happen, because otherwise, where is the joy in life? We need to celebrate those good things too. But it's just being sensitive that actually that might be incredibly triggering for some members of the organisation, and giving them the safe space to actually be able to dip out of that and not attend, or have an awareness it's going to happen, so that perhaps they can work from home that day, or whatever it is that will help to get them through. But yes, you're absolutely right, that is a huge trigger for people.
And lots of it's about communication, isn't it? So it would encouraging people to make those sort of disclosures and discuss what they're going through with their employer or with their line manager, so that the sensitivities can be put in place in relation to things like that. Okay, well, that's been really, really fantastic and great to talk about, and hopefully inspired some employers to start thinking about this sort of thing. Are you still helping organisations develop their policies? And
yeah, 100%. We're really busy with it, and we have some great organisations on our books, so we're really pleased. So yes, absolutely, we still are.
Okay, well, so if anybody wants to get in touch with you, where can they find you?
So on my website, which is yourfertilityjourney.com, there is a page dedicated to fertility in the workplace. I think it might be called corporate organisations. I can't remember what it's called now, but you can see it in the top banner. And that's where you can find out information about the work that we do. We're also on LinkedIn, so anyone can find us on LinkedIn and see the work that we've been doing. And just to get in touch, arrange a call, and we can start having a chat and see what your organisational needs are.
And you have your own podcast as well, don't you?
I do. So I've worked on the Fertility podcast for the last 2.5 years with my co-host, Natalie Silverman, who also is part of Fertility Matters at Work that I've mentioned. Mm-hmm. And Natalie started the podcast about 8 years ago when she was finally pregnant after an IVF journey. And I joined her 2.5 years ago. And then now she has stepped away, and I'm taking the reins with a brand new series coming out next month. So I'm very excited.
Oh, that is interesting. Yes. And I think I mentioned that I'd met Natalie at a podcast event probably about 8 years ago or so, when she's probably just starting out. So it's a small world in the podcast world.
It is indeed.
It's been great to talk to you. Thank you so much. And I'm sure we'll have lots of interest in relation to this, and know where to send people when they're looking for their fertility help.
Lovely. Thank you so much, Alison. Thank you again for having me. I've really enjoyed it.
Well, I'm sure you'll agree that episode was really interesting and insightful. And if you've been inspired to have a look at your internal policies and procedures, or potentially look at changing the culture within your organisation to provide more support for your employees going through their fertility journey, then you can get in touch with Kate. All the details are in the show notes. Or alternatively, if you'd like some help on the legal side of things, you can contact myself or the team. You can contact us by email. It's alison@realemploymentlawsadvice.co.uk. or by telephone. Our head office number is 01983 897 003. Thank you so much for listening to the podcast. I really appreciate it. If you have enjoyed this podcast, I'd be grateful if you could like it, leave a comment, or share it with those people that you think might find it helpful. And of course, if you're not a subscriber, wherever you're listening to this, it'd be great if you could subscribe and download the podcast. I hope you have a fantastic 2 weeks ahead, and I'll be back with the podcast in a fortnight. Thanks again for listening. Just want to finalise by saying I wouldn't be a lawyer unless I had a legal disclaimer. So I must just say to you that the information in this podcast is for information only. It's general review and a general update. It's always necessary to get specific legal advice about your circumstances. So please don't rely on anything that you've heard in this podcast. But please do feel free to contact me if you'd like further information or specific advice.